Be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Introduction. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Within the intricate tapestry of human physiological systems, the sympathetic nervous system, SNS, stands as a cornerstone, orchestrating responses to stress and maintaining equilibrium. At the heart of this system lies the intriguing class of medications known as beta blockers, which intricately interact with adrenergic receptors to temper the SNS's effects. This essay embarks on a comprehensive exploration of beta blockers, delving into their multifaceted mechanisms, diverse types, extensive medical applications, potential implications, and emerging horizons for research and practice. Understanding beta blockers, a glimpse into the intricacies. Beta blockers, also referred to as beta-adrenergic antagonists, represent a pharmacological realm dedicated to regulating beta-adrenergic receptors, prevalent in tissues like the heart, lungs, and blood vessels. These receptors manifest as two primary subtypes, beta-1 receptors in the heart and beta-2 receptors in the lungs and vasculature. The crux of beta blockers' action lies in their binding to these receptors, thereby obstructing the impact of endogenous adrenergic agonists, notably epinephrine and norepinephrine. This interception triggers a cascade of effects that culminate in the moderation of the sympathetic nervous system's activities and resultant physiological responses. Beta blockers unveiled, types and impacts. Beta blockers manifest in distinct iterations, selective, or cardioselective, and non-selective. The former zeroes in on beta-1 receptors, primarily influencing cardiac dynamics while confining impacts on bronchial and vascular systems. Conversely, the latter casts a broader net by engaging both beta-1 and beta-2 receptors, thereby influencing not only cardiac activities but also lung and vascular functions. Navigating mechanisms and manifestations, medical applications of beta blockers. A symphony of physiological responses unfurls as beta blockers exert their influence. A key determinant is the modulation of the heart rate and contraction strength, culminating in reduced cardiac output and blood pressure. This intricate orchestration finds practical applications across a spectrum of medical scenarios. 1. Hypertension. Beta blockers emerge as stalwart allies in the battle against high blood pressure, curtailing cardiac output and heart rate to usher in a decline in blood pressure levels. 2. Angina. By alleviating the heart's oxygen demand and diminishing its workload, beta blockers provide relief from angina, a condition marked by chest pain stemming from inadequate blood flow to cardiac muscles. 3. Arrhythmias. These medications emerge as arrhythmia stabilizers, steadying irregular heart rhythms through the modulation of electrical impulses and the restoration of rhythmic cardiac contractions. 4. Heart failure. Beta blockers take center stage in heart failure management, bolstering cardiac functionality and alleviating symptoms by diminishing the heart's workload and augmenting its efficiency. 5. Migraine prevention. In the realm of neurological health, beta blockers exhibit prowess in curbing the frequency and intensity of migraines, although the underlying mechanism remains partially shrouded. 6. Anxiety management. Notably, beta blockers offer solace to individuals grappling with anxiety and performance-related apprehensions, reining in the physical manifestations of stress, such as palpitations and tremors. Delving deeper, considerations and broader implications. While the therapeutic potency of beta blockers remains undeniable, their application demands discernment. Varied individual responses necessitate vigilant monitoring of heart rate and blood pressure, particularly among patients with pre-existing cardiovascular conditions. The discontinuation of beta blockers requires circumspection, as abrupt cessation can trigger rebound effects, underscoring the importance of medical supervision. Conclusion: exploring new frontiers. In the annals of medicine, beta blockers stand as monumental achievements, their interactions with adrenergic receptors casting a far-reaching influence across a spectrum of physiological functions. As research uncovers the nuanced dimensions of beta blocker actions and their potential applications, these medications remain steadfast guardians of cardiovascular health, epitomizing the union of scientific knowledge and medical care. The journey of beta blockers continues, guiding practitioners and researchers toward innovative paradigms, thereby fortifying their role in optimizing human well-being.